Rhinoplasty is an alteration, it's not a restoration. Restoration is things like a facelift, for example. Your face has started to change and we restore it to the position it was. In rhinoplasty, we're actually changing things and there's components to be changed. Most patients that undergo rhinoplasty have wanted their rhinoplasty since they were 12 years old. They tell me that they avoided photographs, they avoided smiling big because the nose would widen, they would pick a best profile this side or the other, and overall they did things to distract from the nose, wearing big glasses, for example, even getting nose rings, these kinds of things. Rhinoplasty can have a profound effect on one's self-esteem. Oftentimes, there is resistance to rhinoplasty. Family members, intentioned, they love you, and they tell you things like, love yourself, you're perfect the way you are. Or sometimes there's religious reasons against changing something, or cultural pressures, or even familial pressures like, this is your grandpa's nose, why are you going to change that, etc. And all of those things are valid. But there comes a time that you decide you are happy with yourself, you're well-grounded and you're a well-adjusted individual, and your nose just bothers you. And it's funny because sometimes I tell patients, nobody has any qualms with getting braces if your teeth are crooked, but God forbid your nose is crooked, then there is all sorts of problems. Now, let's say you've gotten to the point that you're ready for a rhinoplasty. You do your research, you decide on your style, because there are as many styles as there are surgeons. And you decide on your surgeon and you look at their qualifications. You decide, okay, this is a person who has a strong background of training and is board certified, whose style I like and who's experienced, and also consistently shows the types of results that you want. It doesn't make a lot of sense if you choose a surgeon whose style you don't like just because they have a reputation, or they were your mom's facelift surgeon, or whatever, or the neighborhood surgeon. You have to like their style as well. It's the other half of the game: qualifications and style. Now, both have checked out and you've decided on your surgeon, and you decide that you're going to go through with it. Rhinoplasty requires some level of mental maturity and emotional maturity as well. And the reason for that is that something that you've dismissed all these years, you haven't looked at, like I said, you picked the favorite profile, etc., didn't really care to show off that much, all of a sudden has changed and becomes the center of your attention. And you're going to look at it from every which direction and evaluate it in all sorts of angles and all of that. And it takes some time for the heart and your mind to get used to that. So you have to be prepared for that. And I tell you this up front before you go into the surgery. And the reason is, no surgery will have a perfect outcome. I don't even know what that means. I say, if we can improve your nose by 70-80%, that's a win. That means there will still be 20-30% of issues, either pre-existing or new, that you'll have. That with this lighting or that angle, you may not like your nose. The idea is to improve it, and improve it significantly, and improve it safely, while you still look like you, while you have a better nose that functions better and looks better. That's the goal. The types of rhinoplasty I do are ultrasonic rhinoplasty, preservation rhinoplasty, ethnic rhinoplasty, and revision rhinoplasty. Ethnic rhinoplasty is a misnomer because we all have our own ethnicity. Which ethnicity are we talking about? But classically, it refers to Asian and African American types of noses. And the reason for that, why is it categorized as its own, is that it's different from other types of rhinoplasties because A, we're dealing with thick skin, weak cartilages, and a low bridge. So in these cases, we want to bring the bridge up generally, refine the tip, and work with the skin. In preservation rhinoplasty, we're not going up here cutting the hump, we're opening up the hump. It's a different approach, it's a modern approach, and I'm one of the pioneers of bringing this technique to the United States. Then there's ultrasonic rhinoplasty, which is essentially not breaking the bones. Imagine a big window, a glass window. You can throw a brick into it, or you can use a glass cutter to precisely cut that glass. Ultrasonic rhinoplasty is the latter. You have much less trauma, much better recovery, much more precise work, and therefore better outcomes. Revision rhinoplasty is when one or two or more surgeries have been done before, and you're not happy with the outcomes. It could be just a little something, maybe a little residual hump, or it could be a hanging columella, a droopy tip. Oftentimes, the story I hear is that the nose looked great initially after surgery, but a couple of months into it, it started to change. The tip started to come down. This area doesn't feel smooth or still wide, or that this area clicks when you move it from side to side. These are the types of things that we deal with. And I do rhinoplasty day in and day out. It's my subspecialty. It's my baby. If you have any further questions, feel free to reach out, and we go from there.